Hello friends, I am Dr. Ankit Goel. Today we will be discussing questions of psychiatry from Grant Test 180. So let us discuss the first question. True statement about projective personality tests include. The correct answer is they often focus on latent or unconscious aspects of personality. So let us discuss in detail. So the answer is option A. Now let us discuss about various projective personality tests. Now the projective personality tests are based on the principle that the way people respond to a vague So it is based on the principle that the way people respond to a vague or ambiguous stimulus is the projection of their underlying So it is based on the principle that the way people respond to a vague or ambiguous stimulus is the projection of their underlying, that is unconscious, feelings or conflicts. So this is the principle, underlying principle of the projective personality test. That is, this means that the people project their feelings on the card. So some vague or ambiguous, important to remember, it is not a direct but it's a vague or an ambiguous stimulus which can have multiple responses. So there are no limit of response. Person can have n number of response of that stimulus and different people can have different responses. Now let us discuss some of the important projective personality tests. The first is the Rorschach ink blot test. Now in this test there are 10 cards which are shown, which are ink blots. Now this test was given by Rorschach. Important. So there are 10 cards shown and the person is asked that what it may be. So these are no direct answers but a vague question is asked. Second important test is the thematic apperception test. Now in this test, person is shown 30 cards which has some or the other event. For example, a person standing or various other events are there on that card, and the person is asked that to tell a story, to write a brief story regarding that card. For example, what happened just before this, who all are there in the picture, what are their emotions, and what will be the future. So these type of questions a person is asked to write a short story, which subsequently help us to determine his inner feelings or inner conflicts. Now some of the other important projective tests includes sentence completion test, and draw a person test. So these are important projective tests. Now coming to some of the objective tests of personality. Some of the objective tests include various questionnaires where the person is asked to answer in a yes or no or true or false. Various questions are given and the person is asked to answer them. Then another is the MMPI, that is the Minnesota Multiphasic Personality Inventory. Then another is the CPI, which is the California Psychological Inventory. So these, then another one may be the 16PF, which is the Personality Factor Questionnaire, or the 16 Personality Factor Questionnaire. So these are some of the important objective tests of personality. Now coming to the next question, to identify the procedure below, the correct answer to this is option B, which is the vagal nerve stimulation. Now let us discuss in detail about vagus nerve stimulation. So answer to question 251 is vagus nerve stimulation. Now some of the various surgical techniques used are: first is the vagus nerve stimulation, then there is deep brain stimulation or the DBS, then there is the cortical brain stimulation. So So these are the various surgical techniques: vagus nerve stimulation, deep brain stimulation, and cortical brain stimulation. Now let us discuss about the vagus nerve stimulation. Now it is the direct, intermittent electrical stimulation of the left cervical vagus nerve. Now this is stimulated via a implanted pulse generator which is on the left chest wall, via the electrodes which are wrapped around the left cervical vagus nerve. So as seen in the picture, there is a pulse generator on the chest wall and there are electrodes around the left vagus nerve which is stimulated with the help of the pulse generator. Now let us discuss further about this. Now the mechanism of action is that the majority of the fibers on the left vagus nerve, they are afferent fibers. They are afferent fibers, and mostly around 80% of them are afferent fibers, and they change the activity of brain stem nuclei, like the nucleus tractus solitarius, the Raphe nuclei, and subsequently these alter the serotonin activity. So important that the left vagus nerve is subsequently stimulated, which carries the afferent fibers, and subsequently these stimulate and alter the serotonin level, which we know is altered in depression. Now what are some of the side effects? Some of the important side effects include voice alterations, dyspnea, and neck pain. Now some of the various indications of using vagus nerve stimulation includes epilepsy, then sequelae of neurological syndromes. Then it is also used as adjunctive long-term treatment of chronic or recurrent depression. So as an adjunctive long-term treatment to chronic or recurrent depression, and who had not adequate response to at least 4 or more antidepressants. So then we can use vagus nerve stimulation. Important. So another important MCQ comes here is, since it is used as an antidepressant, so if asked vagus nerve stimulation of the vagus nerve may cause which type of symptoms? Hence it can cause manic symptoms. Again important MCQ. Now let's go to the next question. Now, which of the following is not considered a mature defense mechanism? So the correct answer to this is option B, that is somatization. So let us discuss about the defense mechanisms. So the answer is somatization. Now we know that Sigmund Freud gave the structural theory of mind, in which he divided mind into id, ego and superego. Now, ego generally deals with the demands of reality, as well as it balances between the id and the superego. So id is the instinctual drive, while superego deals with the ideal behavior which one should have in the society. So for example, while a child is studying, so the id may say that just go out and play, while the superego may say that no, you have to study for at least 4 hours. So here the ego comes into the respite and balances both and say that let's study for 2 hours and then we can go and play. So this is how ego generally works. So it balances. But sometimes, when the anxiety becomes overwhelming, ego defends itself by certain unconscious techniques to decrease anxiety. So sometimes ego uses certain unconscious techniques. Remember, importantly, these are unconscious techniques, and these techniques are known as ego defense mechanisms, or simply defense mechanisms. Now, there are 4 types of defense mechanisms. First are the narcissistic defense mechanisms, then immature defense mechanisms, then neurotic defense mechanisms, and the mature defense mechanisms. Now, let us discuss about the mature defense mechanisms. Now, these are 6 in number, which we can learn with the mnemonic ASH, A3, S2 and H1. So this is how we can learn with a mnemonic the various mature defense mechanisms, which include: first, altruism; second, anticipation; third, asceticism. It is derived from the word ascetes, which means monk-like. Then fourth is sublimation, then fifth is suppression, and sixth is humor. Now, we had discussed that these ego defense mechanisms are unconscious, but one of the defense mechanism is a conscious defense mechanism, which is suppression. Important. So, these are important mature defense mechanisms, which we should remember. We can remember by the mnemonic ASH ASH. Now, let us discuss the next question. Now, 36-year-old woman in sleep laboratory, she has a decreased latency of REM. So, which is the disorder the woman is most likely suffering from? The correct answer is option B, that is major depression. So, let us discuss about this. So, the answer is major depression. Now, there are some of the what we known as some vegetative disturbances in depression. These are accompanied by alterations in the biorhythm, like sleep, feeding, and that is which means that they are mid-brain dysfunctions. Important. Now, let us discuss some of the sleep disturbances which are seen in depression. Now, the first important is there is a premature loss of the deep wave sleep or the short wave sleep. So, there is a decrease in the short wave sleep. Now, as we know that sleep is divided into two stages. There is the non-rapid eye movement NREM and rapid eye movement REM. Again, NREM is divided into N1, N2 and N3. So, while earlier the N1 there was stage 1 which is now known as N1, there was stage 2 which is now known as N2, and two previous stages, that is stage 3 and 4, are now clubbed in as what is known as N3. So, this decreased sleep is actually the stage 3 and 4, that is which is now stage N3. This is decreased in depression. Now, another important change is the increase in the REM drive, especially the phasic REM. So, there is an increase in the REM drive. Subsequently, also there is increase in the REM density. And also now, before initially the sleep starts with NREM, and then there is the first REM, and subsequently they alter in the sleep. So, the time between the REM to start and the first REM, so time period from the NREM to start and to the first REM to occur is known as REM latency. important. So REM latency is the time period from the start of NREM to the first REM, and usually this is 90 minutes. But since there is an increase in the REM drive, increase in the REM density, so there is decrease in the REM latency in depression. So this means that when the NREM starts, the first REM to occurs before 90 minutes. So there is a decrease in the REM latency, very important, which occurs in depression. Another important disorder where REM latency decrease is narcolepsy. So in narcolepsy also there is a decrease in the REM latency, very important. Now, some of the other important changes in sleep in depression includes there is increase in the nocturnal arousal. Then there is increase in the nocturnal awakenings. There is a decrease in the total sleep time. So there is a decrease in the total sleep time. There is increase in the core body temperature, and also there is a decrease in the sleep maintenance. So these are also some of the important changes in sleep. The most important to remember is there is a decrease in the REM latency, very important. Now let us discuss the next question. A 5-year-old boy does not show any interest in other children, ignores adults other than his parents. He spends hours lining up his toys or spinning their wheels, but does not use them in the make-believe play. And he also rarely uses speech for communication. So the most likely diagnosis is option D, that is autism. So let us discuss about this in detail. So 254 answer is autism. Now it is now described under autism spectrum disorder, and also previously known as pervasive developmental disorders. So also known as ASD, autism spectrum disorder, or pervasive developmental disorder. These are a group of neurodevelopmental disorders. Now, important core features of autism spectrum disorder are, there are two core features. Of autism spectrum disorder. The first is impairment. The first is impairment of social communication. So there is impairment in the social communication by the child. So which can be indicated that there is a lack of social smile when the child is an infant. Then there is often poor eye contact. There are deficits in spontaneous plays, and there is a awkward social behavior or an inappropriate social behavior. So child does not communicate socially with the children, with the peers, with the people around, may communicate with just one or two people like the parents. That too may be impaired. So first important core feature is there is impairment of social communication. Second important is there is restricted and repetitive behaviors. So there will be some restrictive and repetitive behavior seen. For example, the expected exploratory behavior is restricted. So as the other peers, the expected exploratory behavior is restricted in the child. Now toys are manipulated in a restricted manner. So the toys will not be played as the normal toys. For example, if child given a car, he would not play as normal children will play, but probably just play with one of the specific parts of the toy, for example the wheels. So there will be a manipulative restrictive manner of plays with the toys. Also the activities or the plays are very rigid, repetitive and monotonous. So the child's activities and the child plays are very rigid, and if someone tries to change it, the child will become very disturbed and very distressed regarding the same, and will try not to change the activities or the play. So these are the two important core features: impairment of social communication and restrictive and repetitive behaviors, which are generally seen, may be seen even in the infants. Now there was earlier another important criteria which now is removed, which was language impairment. Now language impairment may be seen, but now it is not a diagnostic criteria for diagnosing autism spectrum disorder. Now what all syndromes and disorders are characterized under autism spectrum disorder? First is autism, second is Asperger's syndrome, then third is childhood disintegrative disorder or Heller's syndrome, then Rett syndrome, and fifth is pervasive developmental disorder not otherwise specified. So not fulfilling the criteria of the above, so it will be diagnosed under PDD, not otherwise specified. So these are the important features of autism spectrum disorder, very important. Now coming to the next question, 53-year-old man consumes around 3 ml of alcohol per day for the past 24 years, presents with severe cognitive deficit, diagnosed with Korsakoff syndrome. So what is the most likely to display in the mental status examination? So here the right answer is option A, that is impaired recent memory and anterograde amnesia. So let us discuss it in detail. So the option is option A. Now what are the various CNS effects of alcohol? Now, it is seen that patients with chronic use of alcohol may have thiamine, vitamin B1 deficiency. This may be either because of decrease in the oral intake of nutrient foods, or because the chronic use of alcohol degrades the mucosal lining, so it may also be due to decrease in the absorption of thiamine. Now, as we know that thiamine is a cofactor in some of the important enzymes like thiamine pyrophosphate, then transketolase, pyruvate, dehydrogenase, and alpha ketoglutarate dehydrogenase. So it is an important cofactor in these enzymes. So when there is a deficiency of thiamine, now these important enzymes are required in the glucose metabolism in the Krebs cycle. Now when there is deficiency of thiamine, there will be decrease of glucose utilization. Subsequently, there will be accumulation of glutamate, which will lead to excitatory damage to the neurons, subsequently lead to various symptoms. Now, in acute stage, this leads to Wernicke's encephalopathy, which is characterized by a triad of symptoms which can be learned with the mnemonic GOA, that is global confusion, ophthalmoplegia, where sixth nerve palsy is more than the third cranial nerve palsy, that is the lateral rectus is affected, and then there is ataxia. So these are the symptoms. When Wernicke's become chronic, important to remember that Wernicke's is reversible. Treatment is give thiamine. Important. Now, when this Wernicke's encephalopathy becomes chronic, this leads to what is known as Korsakoff syndrome or psychosis, Korsakoff psychosis. Now, this is because of atrophy of the medial thalamic nuclei, then the mammillary bodies, and the hippocampus. So these are the important parts affected. Now, what are the various clinical features of Korsakoff psychosis or Korsakoff syndrome? Now, first is it leads to amnestic syndrome, where there is inability to recall new information, especially the recent and remote memories are impaired. Important to remember is that the immediate memory is intact. It is especially the recent most affected. So it leads to severe interrogate amnesia. Now, other important findings may be that confusion may be seen, and again important, confabulation may again be seen in Korsakoff syndrome. Now, we had discussed that Wernicke's is a reversible syndrome, while Korsakoff, or it occurs in chronic state first, and it is irreversible. Although thiamine may be used, it may be partially reversible, but in general it is irreversible. So important to differentiate from Wernicke's encephalopathy. Now, let us come to the next question. A 35-year-old female lived in a psychiatric hospital for 10 years, spends most of the time rocking, muttering softly to herself, looking at her reflections in mirror, dressing and showering. For that she needs help. She giggles and also laughs for no apparent reason. So most likely diagnosis. The correct answer is option B, that is schizophrenia, disorganized type. Now, let us discuss some of the important types of schizophrenia. So answer is schizophrenia, disorganized type. Now, various subtypes of schizophrenia. Now, these subtypes are classified by ICD-10, International Classification of Diseases 10, but now in the recent DSM-5, these subtypes have been removed. Now, these can be, various subtypes include paranoid schizophrenia, Phrenic, or disorganized, catatonic schizophrenia, residual schizophrenia, then post schizophrenia, post schizophrenic depression, then undifferentiated, then simple schizophrenic. So these are some of the important. Then there may be other. So these are some of the subtypes of schizophrenia which are described under ICD. Now coming to the Phrenic. Now prognostic wise, good prognosis includes catatonia, which is the best prognosis, followed by paranoid, and poor prognosis is simple more than hebephrenic. So these are the good and the bad prognostic schizophrenias. Now let us discuss about hebephrenic schizophrenia. Hebephrenic or disorganized. Now the word hebi was given by Hecker, important, on the Greek god of youth, that is Hebe. So it was seen that in schizophrenia with early onset, this is schizophrenia of early onset, being derived from the Greek goddess Hebe, which is goddess of youth. So it's a early onset schizophrenia. So now it is, clinical features include that there is marked regression to primitive disinhibited behaviors. Then there is active but aimless non-constructive behavior, smiling or giggling to self is present. Then there is poor contact with reality, and also there is pronounced thought disorder. So these are some of the important characteristics of hebephrenic or disorganized schizophrenia, important to remember. Now coming back to the next question, 20 to 57, 15-year-old is brought to OPD, impairment academics, and there is an image shown. All of the following are treatments of the disorder seen in the image except. So let us first see the image. Now, so there are irregular patches of alopecia, and the treatment which is generally not used for the treatment is option C, that is electroconvulsive therapy. Now let us discuss what is the diagnosis. So answer to question 257 is option C, that is ECT is not used. So the diagnosis here is hair pulling disorder, also known as trichotillomania. Now, so let us discuss about the hair pulling disorder or the trichotillomania. Now, it is characterized by repetitive hair pulling. Now, the term trichotillomania was given by a French dermatologist known as Francois Hallopiu. Now, hair pulling disorder or the trichotillomania under ICD-10 are described under habit and impulse disorder, while in the DSM-5 they are described under OC, obsessive compulsive and related disorders. Now, there are two types of hair pulling. First is the focused pulling, which is a intentional act which is due to some unpleasant experiences. Is some unpleasant urge which leads the person to pull his hair. So this is a intentional or a conscious pulling. Then there may be automatic pulling, which is the pulling is outside someone's awareness. So this is unconscious. Now most common areas affected are, first is the most common is the scalp area, then other areas like eyebrows, eyelashes are also, beard, and also other body hairs may be affected. Now treatment, generally the pharmacological treatment includes drugs like SSRI, like fluoxetine, sertraline. SSRIs are used. Then other drugs like venlafaxine, lithium, bupropion, they may be used. Now non-pharmacologically or psychotherapy or other non-pharmacological management includes cognitive behavior therapy, that is CBT, then biofeedback, then habit reversal, then insight oriented psychotherapy. So these may be used for the treatment. Again, ECT is not used for trichotillomania or hair pulling disorder. Now let us come to the next question. Onionomania is another term used for, the correct answer is option A, that is compulsive buying. So answer to 258 is A, that is compulsive buying. Now it comes under habit and impulse disorder, the omniomania. It is characterized by repetitive compulsive act of buying. Although the things which the person has bought may not have any value to it, but it is being bought because of some urges to buy the thing. Now one needs to rule out mania or hypomania before diagnosing oneinomania, because in mania and hypomania also person may have a spree of spending a lot of money on buying certain expensive things. Now this is more seen in women than in men. Now various other habit and impulse disorder, first we had already discussed trichotillomania, then various others include pathological gambling, then pathological fire setting, that is pyromania. Then there is also pathological stealing, that is kleptomania, again important. So again in this, the person does not steal for any monetary or other benefits, but it is because of the urge to steal. That is why the person would steal. So these are some of the important habit and impulse disorders. Let us discuss the next question. Adjustment disorder. So the correct statement is option C, that is, are one of the most common psychiatric diagnoses in hospitalized patients with medical problems. So answer to question 259 is option C. Now, adjustment disorders. Now these come under the anxiety disorders with trauma and stress related disorders. Now, adjustment disorders are emotional responses to a stressful event. So these are the emotional responses to a stressful event. Now they are also characterized as state of subjective distress and emotional disturbances, which usually interfere with functioning. So because of some stress, there is subjective distress and emotional disturbances which usually interfere with functioning. What do you mean by interfering with functioning is that the person is not able to perform various social functioning like interacting with people, working occupational functioning like the workplace where the person works, or in the school or in the college. He is not able to cope up with the various activities. So there is interference of functioning. Now, generally the stressor may be a medical illness, some financial losses, there may be loss of a loved one, also there is bereavement or separation, or some change in positions like change in house, change in the social stature, change in the position in job. So these are some of the important stressors which can precipitate adjustment disorder, and it is very commonly seen in patients hospitalized with a medical illness or sometimes a chronic medical illness. So it is very commonly seen in such patients. Now usually it begins within 1 month of the stressor, and generally duration is not more than 6 months, and we generally don't diagnose adjustment disorder if it occurs more than 3 months after the stressor. So these are some of the important durations required for making a diagnosis. Now some of the various subtypes include, first is a brief depressive reaction which generally is of less than 1 month, then prolonged depressive reaction. Now it generally is not more than 2 years. Now we say that we generally don't, the duration is generally not more than 6 months, but in the prolonged depressive reaction it may last up to 2 years. Then there may be mixed depression and anxiety reactions. Then there may be predominant disturbance of emotions, then there may be predominant disturbance of conduct, that is of the behavior, or there may be mixed disturbance of emotions and conduct. So these are some of the important subtypes of adjustment disorder. Now another important thing to understand is, when even if there is a stressor but the person is fulfilling criteria of other illnesses, like let us say depression or anxiety disorder or other disorders, so then we will give preference to these disorders. So we will make a diagnosis of these even if there is a presence of a stressor. Hence adjustment disorder would come as a last option if all these disorders are ruled out. So this was the answer.